The radius is the forearm bone located on the same side as the thumb. Like most long bones, it can be divided into three main sections: the proximal end, the shaft, body, and the distal end. Proximal end of the radius. At the top of the bone is the head of the radius. This part has a slightly cylindrical shape and participates in two different articulations. On the upper surface of the head, there is a shallow concave area known as the articular facet. This surface articulates with the capitulum of the humerus, forming part of the humero-radial joint. Surrounding the outer edge of the head is the articular circumference. Instead of contacting the humerus, this surface articulates with the radial notch of the ulna, creating the proximal radio-ulnar joint. When viewed together, these structures form part of the elbow joint complex, which consists of three joints: the humero-radial joint, the humerulnar joint, the proximal radio-ulnar joint. Just beneath the head lies a narrowed region called the neck of the radius, which connects the head to the shaft of the bone. Orientation of the radius. When the radius is positioned in the anatomical position, we can observe both the anterior, front, and posterior, back, surfaces of the forearm. Understanding this orientation helps identify the structures located along the shaft. Shaft of the radius. One important feature near the top of the shaft is the radial tuberosity. This roughened projection is located on the medial side of the anterior surface, just below the neck. The tendon of the biceps brachii muscle attaches here. When the biceps contracts, it pulls on this tuberosity, producing flexion of the forearm at the elbow joint. The shaft of the radius also has three borders: anterior border, located along the front of the bone; interosseous border, positioned medially and facing the ulna; posterior border, located along the back of the shaft. The interosseous border provides attachment for the interosseous membrane, a strong fibrous sheet connecting the radius and ulna. This membrane stabilizes the forearm and helps transmit forces between the two bones. Between these borders are three surfaces: anterior surface, posterior surface, lateral surface. Each surface serves as an attachment site for muscles of the forearm. Distal end of the radius. At the lower end of the radius, one of the most noticeable landmarks is the styloid process. This projection is located on the lateral side of the wrist and can easily be felt through the skin. The styloid process provides attachment for several structures, including the radial collateral ligament of the wrist, the palmar radiocarpal ligament. These ligaments help stabilize the wrist joint. Just above the styloid process is a small ridge called the suprastyloid crest, which serves as the insertion site for the brachioradialis muscle, a muscle that assists in elbow flexion. On the posterior surface, several grooves guide the tendons of extensor muscles as they travel into the hand. Nearby is the dorsal radial tubercle, also called Lister's tubercle. This small projection functions like a pulley, guiding the tendon of the extensor pollicis longus muscle. On the medial side, we find the ulnar notch of the radius, which articulates with the head of the ulna to form the distal radio-ulnar joint. The inferior surface of the distal radius forms the radiocarpal joint, which is the primary joint of the wrist. This surface has two articular areas, one for the scaphoid, one for the lunate. The ulna. The ulna is the second bone of the forearm and lies on the medial side, corresponding to the side of the little finger. Like the radius, it is divided into three regions: proximal end, shaft, body, distal end. Proximal end of the ulna. At the top of the ulna is the olecranon, a large curved projection that forms the point of the elbow. Below it is the trochlear notch, a large C-shaped depression that articulates with the trochlea of the humerus to create the humerulnar joint. Just beneath this notch is the coronoid process, which fits into the coronoid fossa of the humerus during elbow flexion. On the medial side of the coronoid process lies a small elevation called the sublime tubercle. This structure serves as an attachment site for part of the ulnar collateral ligament and also for the flexor digitorum superficialis muscle. Another feature in this region is the tuberosity of the ulna, located just below the coronoid process. This area is the insertion point for the brachialis muscle, one of the primary flexors of the elbow. Shaft of the ulna. The body of the ulna also has three borders: anterior border, interosseous border, posterior border. The interosseous border, which faces the radius, provides attachment for the interosseous membrane. Near the upper part of this border is the supinator crest, where the supinator muscle originates. The posterior border runs along the subcutaneous surface of the forearm and can easily be felt beneath the skin. Between these borders are three surfaces: anterior surface, posterior surface, medial surface. Each of these areas provides attachment points for forearm muscles. Distal end of the ulna. At the lower end of the ulna is the head of the ulna, which has a rounded shape. Extending from it is the ulnar styloid process, a small projection located on the posterior and medial side of the wrist. Unlike the radius, the distal ulna does not directly participate in the wrist joint. Instead, the articular circumference of the ulnar head articulates with the ulnar notch of the radius, forming the distal radio-ulnar joint. A small articular facet on the lateral side of the head interacts with the triangular fibrocartilage complex, TFCC. Movement of the radius and ulna. One of the most remarkable features of the forearm is the ability of the radius to rotate around the ulna. This movement allows the hand to perform pronation, turning the palm downward, supination, turning the palm upward. These movements are produced by muscles such as the pronator teres, pronator quadratus, and supinator. Structures holding the bones together. The radius and ulna are connected by several important structures. Proximally, the elbow joint. Distally, the distal radio-ulnar joint. Along the shafts, the interosseous membrane. The interosseous membrane not only stabilizes the bones but also transmits forces between them and provides passage for vessels and nerves such as the anterior interosseous artery. Another small structure called the oblique cord extends from the ulna to the radius just below the radial tuberosity. Although not always emphasized in textbooks, it contributes to the stability between the two bones. That's all for now. Please remember to like, subscribe and turn on your notification button for you to receive our exclusive content. See you next time.